Okay. All right, everyone. If you're not speaking, please keep yourself muted. We'll have some time for questions at the end of the Congresswoman's opening remarks. With that, I'll kick it over to the Congresswoman.
Good morning. Good morning, everyone. How are you? I was just saying to the staff, if we did this in person, we would have coffee and donuts. But what can I tell you guys, um, but thanks so much. Thank you very, very much for joining with us today. 10th day of the Republican shutdown. So I just share an update of kind of where things stand at the moment. The Speaker of the House, as you know, canceled votes this week. We're at about 20 days at which out of session, which is pretty remarkable. September 19th was the date that the last date that he called us into session here. So myself, I'm in DC. There are a number of members who are here. We were mostly all here last week, and over the issue of dealing with the healthcare issue and the costs for more than 20 million Americans. So I'll characterize it the way others have. I mean, folks are on vacation. It's where are they? And if you will, where's Waldo, for God's sakes? Why aren't they here? Um, let me just characterize. I was at home at the beginning of the week where I talked to doctors. I went to the disability community to talk about how all this affects all of them, how all of this shut down, and the healthcare cost primarily is what happens to their ability to afford health care. And I know that in the next couple of weeks, families in Connecticut are going to be receiving the notices from their health insurance companies about the increase in premiums. So for anyone who gets their coverage through Access Health, that's about 142,000 residents in Connecticut. Monthly insurance premiums could double. A family of four living in Milford who has an income of $30,000 now pays $921 a month. They're not going to pay $2,800 a month in 2026. It's an increase of almost $23,000 a year. You tell me who can afford this kind of an increase. And the issue on whether we can discuss this in the next several weeks, or we discuss it now. The speaker says, let's wait until December. But I think you all know that I said the notices are going out probably on the 20th of this month in Connecticut. Then you have the open enrollment period starts on November 1st. You have to have the first payment made by December 15th in order for you to have health care on January 1st of next year. So, I always speak about when the increased costs go up, I put that in the context of a cost of living crisis, which I have viewed for a very long time is the single biggest issue around the country. That goes back to last year. And so prices for groceries, housing, children, basic necessities are unaffordable because people do live paycheck to paycheck. And the healthcare costs are the primary drivers of cost of living. If you're sick, if you can't get good care, the consequences are dire. Injuries, illnesses can't be ignored. People die. You've heard me say it before. It is not roads, bridges, or helicopters that we make in Connecticut, but it is about people's lives and their health care. So, and these prices impact more than 20 million people. I think they're now talking about 24 million people around the country. Congressional Budget Office, CBO, estimates more than 2 million Americans will lose access to health care next year, solely because of the increase in prices for insurance that they purchase on the state marketplace, like Access Health. Connecticut. I think what we're seeing, and it is the dam breaking here. Republican opposition to addressing the crisis. Marjorie Taylor Greene of Georgia, outspoken, and she made it very, very personal. She talked about her kids not being able to afford the increase in the prices would be. You had the speaker was on C-SPAN, I guess that early morning show, where the call-in show. The Speaker of the House is on the call-in show on C-SPAN in the morning. I guess more power to him for doing that. But a Republican military spouse, mother of two, confronted him, for not bringing the House back into session. I have to believe that behind closed doors, that there is a lot of angst amongst my Republican colleagues of why they are not here. And they were the folks that said, shut down remote voting during the pandemic because we should be here in person. Well, they should be here in person. And unless we do something about these healthcare costs, these prices are going up. The 10 top states where healthcare costs will increase the most are all Republican-led states. West Virginians see their costs go up by 387%. Alaskans, 346%. Folks in Tennessee, Mississippi, Wyoming will see their prices increase by more than 300% next year unless we do something. Not a partisan issue, not asking for anything outrageous here. Just want to have Americans have access to the medical care that they need. You even had, and I'm going to end on this, you got a Thune in the Senate, the majority leader in the Senate. He says that he is open to dealing with the issue of the ACA subsidy. So with that, let me hush up and let me answer your questions.
If you have a question, please use the raise hand feature. I will call on you to ask your question. Please, when you ask your question, let us know who you are and what outlet you're with. All right, we'll start with Jonathan Salant. Please unmute yourself and ask your question.
Hi, Jonathan.
Are you there, Jonathan?
Yeah, I am. Yeah.
Hi.
Jonathan Salant, New Haven Independent. One of the things that Congresswoman DeLauro, you've talked about before is withholding the money, that even if you get the subsidies, there's nothing stopping vote from saying, I'm not going to spend the money. How do you get around that, even if there is an agreement?
Yeah. Well, look, as part of the, I point you in the direction of the continuing resolution that Senator Murray and I introduced. And what we have dealt with are the healthcare issues, without question. As I say, they're the biggest drivers of the increase in cost for people today, and with the issue of their cost of living. But the other piece of this is we also put in there several options in which we can deal with the issue of Russ Vought, the President Trump, stealing funds that have been appropriated by a House and Senate Democrats and Republicans. These are appropriated dollars, and those dollars, it's in the law. So we address both of the issues in the continuing resolution that we moved forward on last week, which the Republicans have rejected. So, but it's a very, very big, important part of the issue. We can't come to a conclusion, strike a deal on the dollar amounts that we're going to spend, for the services that we provide for people in this country, and then have some unelected bureaucrat like Russ Vought say, well, no, hey, I don't think we should go there. So we do address it.
Right. Well, our next question will come from John Craw. I hope I'm saying that correctly. Please unmute yourself and ask your question.
Hi, Rosa. John Craven with News 12.
Hi, how are you, my dear?
Good. How are you, Rosa?
Good.
So John Thune is floating the idea of promising Democrats a future vote on extending the subsidies.
Did you hear my answer, John? Huh? Are you joking? I keep saying this. I got a bridge I want to sell you. This is ridiculous. Let's do it. Let's do it now. Let's do it now. Look, I don't mean to make light of it. They have walked away from every single agreement I mean, so not a deal. They walked away from deals. They walked away from agreements. They cannot be trusted in this regard. Isn't it, talk about good faith efforts. Russ Vogt throws on the table in the midst of our dealing with negotiations the whole issue of another stealing of the funds through another rescission, which cuts out the Congress altogether with a pocket rescission. You tell me. Would you take a handshake on that?
That's my question. Thanks.
You got it.
Thank you. Jen, I think that might be a mistake though.
Hey, how are you?
Okay, go ahead.
This is Jen Schultes from Politico. Sorry, I don't know why I'm just coming up as Jen, very informal. My question for you, Congresswoman, is kind of piggybacks on the last two questions. Even during the shutdown, the Trump administration is shifting money without Congress's consent, saying they're going to shift money to WIC from tariffs and pay the troops anyway. GAO found in 2019 that they violated the Anti-Deficiency Act for doing things that were kind of less brazen and than that, like using park fees to keep the parks open, which is a little bit more adjacent than using tariffs to pay for WIC. How do you feel about them doing that in this context when the fight is about them shifting money and then now they're and GAO had said that that they could face jail time and fines, under the Anti-Deficiency Act before if they did it again.
Yeah, well, look, you just, you laid it out very, very clearly. They are violating the law left and right. They started this at the outset. There's no inherent power that the president has, and certainly no inherent power that Russ Vogt has to move money around that's been appropriated by, as I said, House, Senate, Democrats, and Republicans. That's the law of the land. They continue, to do this. So again, it's why do we want to believe that they are going to, address the issues? And there's a willingness, which is really pretty extraordinary, to shut the government down rather than to negotiate with the Democrats. You know what the president says. You would think you may have even reported it. He said it's a waste of time to talk to Schumer and to Jeffries. He also said to the Republicans, pass this Republican continuing resolution, cram it down the throats of the Democrats. Again, when you're in a negotiation, you're tough, you're hard, but you have to have a willing partner to negotiate with. We have no willing partner, and they continue to break the law in doing this. And that has to stop, which is why in the alternative that Patty Murray and I put forward, we address both issues. The healthcare issues, we also address the issues of them stealing the resources. And they come up with, they're going to use the tariffs for farmers. They're going to use the tariffs for WIC. They should be fined. They also, given what they're saying, and there's, in violation of the Hatch Act, there are penalties with anti-deficiency, and there's penalties, and there are personal penalties with anti-deficiency, and there are penalties which should apply. And I trust the GAO. GAO has been under unbelievable pressure from the administration, but they stand tall and they do their job.
Do we have any more questions? Again, please use the raise hand feature. Looks like we have one. Oh, nope. All right. Do you have any closing remarks, Congresswoman?
Well, the only thing I would just say, it's interesting to me, just not a few weeks ago, that there wasn't any. This is, please don't take offense at this, because I do a lot of watching of the national media, as you all do, and the media here and local media. The issue of healthcare and the cost of healthcare was not on anyone's mind, and speaking about it and talking about it and quite frankly reporting about it. It is now the center of public discourse, as it should be. And that is what is the dominant issue in this effort. And it is as a result of the big, beautiful bill, what happens with Medicaid, what happens with Medicare, what happens with, the Affordable Care Act, which they have been trying to decimate for the last 15 years. And the premium subsidies. They could do nothing with the premium subsidies which come due in December. They can manipulate what they try to do with Medicaid in dealing with that after an election. But people understand Medicaid and what it means in their lives. You talk to the mother who had a premature birth, baby born at 33 weeks, and is getting Medicaid benefits with a program in Connecticut called Birth to Three. And the fear, if this was not there, because the program provided her and her family with the information to teach her baby how to crawl, how to walk. The young woman who spent 20 years in Connecticut Valley Hospital and in Middletown for mental health issues, who through Medicaid and the services provided through Medicaid is now able to live independently and to have a job. These are the realities. The doctors who tell me that 40% of kids in Connecticut are on Medicaid and what happens there. But it's sinking in. People are understanding this. And I've talked about the premium subsidies because they come due, and that's immediately. October 20th is not that far away in Connecticut. It's going to be a stark reality of what this means. But we brought this to light as it should be brought to light. Was hidden not that many weeks ago. And it's important for the public to understand what's happening in Washington. And this is healthcare, which is so imminent. But it's happening in public education, which is being dismantled. It's happening with all kinds of services. And the public needs to know this. And we need to tell that story. So I'm grateful for the opportunity to talk to you today. My hope is that soon we can gather in person and we will have coffee and donuts.
It looks like we have one last question.
Okay, go for it. Let's go.
Please unmute yourself and ask your question.
Let's go.
Hi, Congresswoman DeLauro. This is Eris Foley, budget reporter at The Hill. I mean, at roll call now. Sorry, just started this week.
Congratulations.
Thank you. Thank you. Wanted to ask, as the shutdown continues, sorry for the sirens in the background, I'm downtown, but as the shutdown continues, is there a point where negotiators need to start talking about a new end date for the CR? Looks like the shutdown is going to continue potentially into, well, of course, into next week. Is November 21 still workable as a deadline for you all to push through some significant funding work?
Let me just say this. We could sit down and talk today. We could sit down and talk today. It's not a question of the end date. It's when the starting date. When do we start? Let's go. I'm here. I'll talk to Tom Cole, Patty Murray, Susan Collins, Jeffries and Schumer. We'll talk to Johnson and Thune. What did Johnson say last week? This week, he said, we did our business. We don't know what the hell we're going to be here next week. Let's start. Let's talk. Let's move this ball forward. It can get done. You have to have the political will to want it to get done. And you know, Russ Vought, he couldn't be happier. It's the proverbial pig in you know what. He loves it because he's, you know, he's just accumulating power because the president doesn't know anything about budgets or about appropriations. And he's consumed with a lot of other things. We could start this tomorrow. The Speaker of the House. That's an unbelievable job. That's great power. Take it, use it. I think it was Lyndon Johnson said, you know, what's the use of having the power if you don't use it? He could use it. He could call everybody back. He could talk to his counterpart Thune and say, let's get serious. We have to deal with the American public. The Democrats and Republicans have to deal with the issues that the American people are facing. Let's try to come to a conclusion, as we have done historically in this process.
All right. Thank you.
Thanks so much, guys. Enjoy the weekend.